We all set? Okay. Good afternoon, everybody. I'd like to introduce myself. I'm P.J. Wendell, County Executive from Chautauqua County. And at this time, we are having a press conference on our COVID-19 response. Right now, we're providing an update on the evolving COVID-19 situation. We've been sending out daily updates around 4 p.m. through the media and different outlets on a COVID-19 newsletter. Also posted to Facebook on the following pages: Chautauqua County Health Department, Chautauqua County Government, and my own county executive page, P.J. Wendell. We have a structure in place with my COVID-19 response team meeting daily to prepare. There is ongoing communications daily with all involved healthcare providers, including physicians, hospitals, EMS personnel, and others. I've also been in communication with local city, town, village, and highway leaders, also along with my federal, state, and other county officials. We are all doing our best to comply with the continuous executive orders being issued by Governor Cuomo, and the county has been taking leadership to assist local businesses and leaders to understand in the implementation of those executive orders. It is very important we adhere to the social distancing measures being put in place to limit potential exposures to the virus and slow potential spread. We know in other countries where social distancing measures were in place, they curbed the spread of COVID-19 compared to countries who did not implement those precautions. On Tuesday, Governor Cuomo mandated that all local governments reduce on-site staff by 50%. My team of department heads have been working hard to evaluate implementation reductions, and we are well below the 50% on-site threshold here in Chautauqua County government. For the complete list of affected offices and locations, visit our county website, chqgov.com, and click on the Changes in County Government Operations alert. We are working on a number of items to assist our local businesses at this time. Our Economic Development and CCIDA teams, Chautauqua County Industrial Development Agency, have been in communication with state officials and are there to answer business questions as best we can. They can be reached during normal business hours at 716-661-8900 to get some specific measures include the following: launch of chqbuylocal.com. This is a comprehensive directory of restaurants across Chautauqua County offering takeout or delivery service and their contact information, making it easy to support our small businesses if you are out and about. The Chautauqua County Industrial Development Agency, CCIDA, is offering low-interest loans up to $10,000 to small businesses for working capital purposes, which we will begin interest only at 3%. Will be interest only for at least 3 months, with typical collateral requirements being relaxed. The U.S. Small Business Administration is offering designated states and territories low-interest federal disaster loans for working capital to small businesses suffering substantial economic injury as a result of the coronavirus, COVID-19. Businesses in all New York State counties are now eligible as of today. At this time, I'm going to turn the microphone over to Public Health Director Christine Schuyler.
Thank you. As of right now, there are still no confirmed cases of COVID-19 in Chautauqua County. We have 35 people in precautionary quarantine. We have gotten test results back that have all been negative so far. We are currently, as of this minute, awaiting 32 test results. Although there are no confirmed cases in the county right now, each day, COVID-19 appears in more communities. I am assuming that the novel coronavirus is circulating here, and I recommend that you do the same. Without the unprecedented community mitigation efforts that are being utilized, such as limiting public gatherings, restricting restaurants to takeout and delivery service, and closing schools, and limiting business operations, we are guaranteed to see a rapid expansion of illness. No one is immune. There is no vaccine available to stop the virus. There is no treatment. But about 80% of the people who contract COVID-19 will experience mild symptoms, and they'll recover just fine at home without medical intervention. Now is not the time to be selfish and go to work and go out in public, go on spring break and hang with your friends on the beach, or visit friends that are ill, especially those at high risk for severe disease, because you could pass the virus on to others. The hospital systems in this county, this state, and this nation do not have the capacity to treat and save the remaining 20% of patients who may need acute care if people all get sick at once. Yes, these mitigation efforts are profound. They disrupt our daily lives, and they are creating real hardship. They are demanding and unprecedented in the sacrifice that's required from all of us. But they are urgent, necessary, and justified in the face of the COVID-19 threat. Every one of us must help. We all have the power to stop COVID-19 and save the lives of the people we care about. We must focus on slowing the spread of cases out over time to protect hospitals and healthcare workers so they can serve the patients who need them. I know that many people are anxious to be tested for COVID-19. The reality is that testing supplies and personal protective equipment such as masks and gowns are in very limited supply in this county, state, and nation. I have recommended that healthcare providers prioritize these limited testing resources for those who are sickest and most at risk. This includes those who are hospitalized and ill healthcare workers. At this time, it is not advised that the general public without symptoms or those with mild to moderate symptoms be tested. Your treatment will not change. We are doing all that we can to open the testing pipeline. In the meantime, you can help slow the spread of COVID-19. All of us need to wash our hands more frequently, try to avoid touching your face, avoid close contact with others, and the social distancing techniques that we have already gone over need to be utilized. If you're 60 years of age or older, avoid groups of people, even family gatherings. Stay at home as much as possible. People who are elderly or have underlying health conditions such as heart disease, lung disease, and I will qualify that right now as something that we're seeing across the nation because of the uptick we've had in those who are vaping. We are seeing some increased lung issues in people who we used to consider young and healthy because of the damage that's now occurring to lungs from vaping. That puts them at a higher risk for complications with COVID-19. I encourage everyone, do all that you can right now to stop smoking and to also stop vaping. If you're sick, stay home and avoid contact with others. We are recommending that you contact your healthcare provider. If you do not have a primary care physician, we will help you to locate one. Very important that you follow the advice of your healthcare provider. You need to know emergency warning signs of COVID-19, which are very similar to other diseases such as influenza. If you have difficulty breathing or shortness of breath, persistent pain or pressure in your chest, if you have a new onset of confusion, or you're not able to arouse someone, or if lips become bluish, those are signs that you don't have enough oxygen going through your body, and those are medical emergencies. The use of emergency transportation, of calling 911 and utilizing emergency rooms really needs to be saved for those who have life-threatening illnesses or injuries. If in this time that you are home from work and you decide to tackle those projects that have been piling up and you accidentally cut your finger off with your saw, that is a medical emergency that you should go to the emergency room for and be treated. If you develop a cough, a sore throat, and a mild fever, that is a medical issue that you need to call your healthcare provider and discuss. Isolate yourself at home so you don't spread the germ around to other people. We are working very closely at the county level with our local healthcare providers, our hospitals, our labs, the state health department, to do all that we can to keep up to date on guidance, communicate the latest guidance the best that we can, work to prioritize testing supplies and personal protective equipment. For instance, masks are not to be worn by healthy people. There is no need. Masks need to be saved for those who are ill and for our healthcare workers and first responders who are taking care of those who are ill. If you have questions on the use of personal protective equipment, the CDC has a great deal of information. I am also going to tell you that today we are working very hard to have our website updated. So when you come to the county government's landing page, you will very easily be able to access information on COVID-19, as well as all of the contact information in case you need to sign up for public assistance, what to do if you need help with your existing case, if you need SNAP, HEAP, if you have a child support question, any of the other services that we are continuing to offer through county government can be accessed there.
All right, at this time, I will take any questions from the media in the room, and then we will go on to questions that we receive via the emails. Any questions in the room? All right. Yes?
Christine, you had mentioned the 32 test results that were waiting. Do you have a total number of tests that have taken place in the county at this time?
Not off the top of my head.
And if you could step to the podium.
Oh, sorry.
What do we even have this here for?
I'm sorry.
Not off the top of my head, I don't. I don't think there's been more than 40. We've had a big increase just this week when testing has been opened up a little more so with the Chautauqua Center and some other options, and we've had the hospitals also doing some testing. Really is up to your healthcare provider still. It is a clinical decision, but we're asking that those decisions be made very thoughtfully and really using clinical guidance to drive that decision.
So then the number of folks in precautionary quarantine right now, that is 35?
Yes, the 4 p.m. update, there are 35 people in precautionary quarantine.
And no positive cases yet.
No positive cases yet.
But officials want people in the community to treat it as if there are positive cases, to follow the correct CDC protocols?
Yes, because we know that this virus is in our communities. It's called community spread. That's the part of when you get to a pandemic where instead of cases being identified from people having the travel history or coming into direct contact with someone who had traveled from a high-risk country, in our nation now we are having person-to-person spread of illness from people who were not from any of those high-risk areas. So that's called community spread. That's why we're doing community mitigation efforts. And I fully assume that the novel coronavirus is here. I really think it's circulating out there. We have limited testing supplies. So although we can't test as many people as we would like to test right now, I feel confident that it's here, but most people will be mildly ill. We need to try to dampen down the panic because 80% of people will be mildly ill or not even know that they're ill. Going to your doctor's office or showing up in an emergency room because you think you need tested for COVID-19 is terribly irresponsible. That test result will not change your treatment. Those people who really have underlying health conditions, are immunocompromised, are pregnant, or are elderly, who develop the more severe symptoms, they are the people who we need to test, identify, and aggressively manage medically.
What makes this spread so dramatic compared to other, say, flu-type things that we've seen before?
Well, we have seen extensive spread with influenza viruses. You know, there have been pandemics in this world with influenza. actually most all of our pandemic plans were made because of influenza. This is a novel coronavirus. Novel means new. So this strain of virus is new to humans. A virus that used to be present in animals has made a jump to people. And now it's made a jump person to person. And we don't know anything about it. We're very quickly learning. Public health experts and researchers are doing all that they can to quickly learn and try to decide how long it lives on a surface, how long the transmission period is, how long it lives on surfaces. But this was something brand new to the medical and academic world. That's why there's just so much unknown. There is no treatment. There is no vaccine, at least with influenza. Even if the vaccine for influenza in any given year isn't an exact match or even a good match with the strains that are there, it still provides you some protection. Even if you get a different strain of influenza, you are going to have some protection. You're going to have a much more milder illness. We have nothing to even give us minimal immunity right now from this novel coronavirus.
So the people who are being tested then, those are folks who have those underlying conditions, or is there a certain criteria for that? Because we've had a lot of viewers who have reached out and said they want to get tested, how do they do it? And at this point it seems like the hospitals can't do that.
It goes back to that, yes, a lot of people want to be tested. Sign me up, I want to get tested. That is not how this is working. There are not testing supplies or PPE in place for anybody who wants to get tested to get tested. And it really would be irresponsible medicine to do so. We need to be smart. We are just coming into the upswing on this bell curve where we are bound to see a surge in cases and in illness. We have to be prepared to identify and treat and to be able to save the lives of that 20% of the population who will most likely be elderly or have an underlying health condition, be immunocompromised, be pregnant, and now we're looking at smokers and vapors. They're the people that are going to need the most of these healthcare resources, and we must protect our healthcare workforce. If we don't have people to take care of our sick people because they're sick, we are also in trouble. So those are our priority populations.
So going forward then, the advice from county health officials would be to the public where if you are sick, just stay home, and if that continues to become a problem where you are deathly sick, and I'm sure that term probably is different person to person, but then they just want to call their primary care doctor for further advice.
Yes, if someone is sick, if they develop a fever, they develop these respiratory symptoms, they're to call their healthcare provider. Healthcare providers right now have been recommended, and they're all going on board with telehealth, so they'll be able to see their patients, talk with their patients, even somewhat examine their patients without the patient having to come into their office. They're doing screenings over the telephone, trying to keep those who have any sort of level of illness out of the doctor's offices so as to not spread the infection and to not get healthcare workers ill. Those are two really big objectives. So if someone is home and they have those symptoms, hunker down, isolate yourself and the rest of your family, your friends. Do what you need to do to help yourself feel better. We're recommending, Tylenol, the usual things, lots of fluids, lots of rest. Call your healthcare provider for advice. And then if your symptoms do worsen, you're going to continue to be in touch with your healthcare provider, who is going to continue to advise you on what to do for your own personal health care. 911 and the emergency room are for life-threatening emergencies, illnesses, injuries, not to go in because you have a mild fever and a sore throat and you really, really want to know if this is COVID-19. It really, for you, does not matter.
So if someone does have an unrelated emergency, how are we keeping our first responders safe as we continue through this time?
Do you want me to answer that? You want to answer that?
I can answer that. Sitting up here right now, I forgot to introduce as our Sheriff Jim Quattrone, obviously Christine Schuyler and Dr. Burke. our county physician. Along with that, Dr. Falk and Dr. Brian Walters, Michael Falk, Brian Walters, are our county physicians as they relate to our EMS providers in Chautauqua County. They have had an extensive, Tuesday night we had an extensive teleconference with all of our EMS providers in Chautauqua County. They were given several different sheets and went through each one of them specifically on how to don and doff, put on and take off safety PPEs, also how to cleanse and sanitize ambulances, the crew members, the stretchers, all those things. So our EMS providers have all been cued on what to do, how to do it, and how to take precautions to save themselves from the spread of this virus. We right now, we have not seen that surge of patients, but the one things we need to do is prepare for that. And that's what our medical directors did for our EMS providers. They prepared, got the information out, quite a bit of information actually. So we feel they're prepared, but this is going to change. Once this rolls out, things could develop rapidly.
How long of a timeline? I know it's hard to say, but a lot of people now are maybe at home or they see these workforce requirements come down from the state. How long is this going to be?
Right now the state is looking at everything at 2-week increments. That's what we've been told last night. We had an extensive conference call last night with all county executives and state leaders, so they're looking at everything in 2 weeks and reevaluate it after 2 weeks. But after that, no definitive time has come out yet.
As for these business requirements, a lot of people are seeing now that up to 75% of the workforce should be working from home. What type of businesses are affected by that, and what type are not?
Okay. So the governor's office, so there's some information. And I don't want to confuse people, but I just got off a conference call before we came down here. So as of tomorrow evening at 8 p.m., all private businesses, excluding the following, I'll read those. If you are exempt, right, you do not. If you are what they consider non-essential, you must go to 50% by tomorrow evening at 8 p.m. The 75% will be by 8 p.m. on Sunday evening. Okay, so there are two different times, okay? So Sunday evening, 8 o'clock, all non-essential private businesses must be at 25% on-site workers. Okay, now this came out today, so we want to inform you that all businesses and nonprofit entities in the state shall utilize these minimum extent as possible. The mandate applies to profit and not-for-profit employers. The essential businesses, these businesses are excluded from those numbers. They're considered essential. They are healthcare operations, including research and laboratory services, infrastructure, including utilities, telecommunications, airports, and transportation infrastructure, manufacturing infrastructure, including food processing, pharmaceuticals, and safety equipment and safety products. Essential retails include grocery stores and pharmacies. And honestly, they are looking also at pet stores because that is a population we need to be concerned with. The other essential services are trash collection, mail and shipping services, the news media, banks and related financial institutions, providers of necessities to economically disadvantaged populations, construction, vendors of essential services necessary to maintain the safety, sanitation, and essential operation of residents or other essential businesses. Vendors that provide essential services or products including logistics, transportation support, childcare, and services needed to ensure the continuing operation of government agencies and provide for the health and safety and welfare of the public. The Empire State Development is also providing guidance to the governor's office with those deeming what are essential and not essential. So there are applications that will come out if you believe your business is essential or not essential. So that determination will be brought out by the Empire State Development. One of the things with this press conference, I want to make sure people are very clear. As the information comes out, we will get it to you. All right, this has been the position of my administration. We formed our COVID-19 team on Sunday. We've been meeting daily, and as soon as the information comes to us, it is very important in my confidence we need to get that out to our public. Those are the people most concerned. With us this afternoon also, we have Senator George Borrello in the audience with us, and also John Griffith, our Emergency Services Director.